Hello, my name is Mercy Kemboy. I'm an anatomy and physiology tutor. I teach diploma nursing students. So in this video, I'll be teaching topics on anatomy and physiology, just making it easier for students to understand. So welcome. Kindly like, share, and subscribe. Thank you. So today we are going to learn about anatomical position and terms related to position and direction. So we shall start by defining anatomical position. What is anatomical position? Anatomical position is a fixed position. So underline the word fixed position of the body from which all these directional and positional descriptions are made. So before we start describing these terms related to position and direction, you need to understand that there is a fixed position in which we assume the person is in order for us to define these terms, these descriptions. Therefore, that is what anatomical position is. So how does this position look like? Or which is this position we are talking about that the person has assumed? So, one, the body is erect. So this means the body is straight, not bending, not seated, straight. So the body is erect. The upper limbs by the side with the palms facing forward, and then feet are together, and the face is looking straight forward. So that is the anatomical position. So if you are asked to describe the anatomical position, you need to mention that the body is straight, limbs where? On the side, palms facing where? Forward, face straight forward. So this is a diagram to show the anatomical position. You can see this diagram. You can see the person is erect, which means the person is standing straight. The palms on the upper limbs on the sides, the palms facing forward, feet together, and the face facing straight forward. That is the anatomical position. So now that we've understood anatomical positions, now let's go and define terms related to position and direction. So terms related to position and direction. The first one, we shall look at superior versus inferior. Superior versus inferior. So what is superior? Superior, you can also say cranial or cephalic. So superior basically means towards the upper end of the body, towards the head. That is superior. So structures that are towards the upper end of the body, then we refer to them as, that is the superior side, or even when you're looking at an organ, then the side that is towards the upper end, that is the superior part, then the opposite will be inferior. Inferior is towards the lower end of the body. So if you're looking at an organ, the side that is towards the lower end, that one is referred to as inferior. So you'll get superior is the opposite of inferior. So if I'm to give an example, let me give an example using the eyes and the nose. The eyes is superior to the nose because it is towards the upper end. And we can say that the nose is inferior to the eyes. I hope that is clear. Then the next one is anterior versus posterior. Anterior versus posterior. Anterior is towards the front of the body. And another word for anterior is ventral. Anterior or ventral. So they mean the same thing. So anterior means what? Towards the front. The opposite will be posterior. Posterior or dorsal. So these terms can be used interchangeably. So you need to know that posterior means what? Dorsal. And dorsal is towards the back of the body. So sometimes even in exam you may be asked, They may not use posterior or anterior, but they can use a dorsal or ventral. So just know that ventral means anterior, dorsal means what? Posterior. Okay, next is median. Median is exactly in the midline. Where is the midline? The midline is an imaginary line that is running longitudinally, cutting or dividing the body into right and left equals. That is the midline. Running longitudinally, dividing the body into right and left equals. Or you can say right and left halves. So this now takes me to my next terms, which is medial versus lateral. Medial versus lateral. Medial, this one is those towards the midline of the body. Towards the midline of the body. Remember, I've already talked where the midline is. So structures that are nearer to the midline of the body, those are medial structures. Those ones away from the midline of the body are lateral structures. So, for example, if I'm looking at the ear and the nose, the ears are away from the midline compared to the nose. So the ears are lateral. Then when you're looking at the nose is nearer to the midline. Therefore, it is a medial structure. The nose is medial to the ears. So that is an example. Next, I'll move to proximal versus distal. Yeah, a lot of students, or from my experience, my students are confused these two a lot, proximal and medial, or they find it hard to understand. So, when you're looking at proximity, something that is proximal, something that is near to something. So it is close or near to the point of attachment of a limb to the trunk. So where is the trunk? The trunk is this point just below the neck, down to your pelvic region. So basically it includes the thoracic cavity, the abdominopelvic cavity, and the back. So that one is what we refer to as the trunk. And attached to the trunk are the limbs, and we have the upper limbs, 2 upper limbs and 2 lower limbs. So they are attached to the trunk at various points. Let's start by looking at the upper limb. When you're looking at the upper limb, or the upper limbs, you'll find that the upper limbs are attached to the trunk at the shoulder joint. The shoulder joint is this joint that is formed by the glenoid cavity of the scapula and the head of the humerus. That is the shoulder joint. So that is where the upper limbs are attached to the trunk. So those structures that are near that point of attachment, we say they are proximal. The structures that are far or they're away from that point of attachment, we say distal. So proximal, near, close to the point of attachment of the limb to the trunk. Distal, away from the point of attachment of a limb to the trunk. Let's look at the lower limbs. So where is the lower limb attached to the trunk? It is at this joint we call the hip joint. This hip joint is formed by the acetabulum and this acetabulum of the pelvic bones and the head of the femur. So that joint is called the hip joint, and that's where the lower limbs are attached to the trunk. So structures that are nearer to that point of attachment, they are called proximal structures. Those that are far from that point of attachment, we say distal. I hope you have understood. Next is supine versus prone. These are terms related to position. And when someone is lying on their back, facing upwards, so the head is on the ceiling, you're facing the ceiling, then that we say that you're in supine position. Then when you are lying on your tummy, facing downwards, then we say that you are in prone position. So supine, lying on your back, facing upwards, prone, lying on your tummy, facing downwards. Now here is a picture. We have two. The first one is the lateral view. The second one is an anterior view. So when you're looking at the lateral view, you can see there's a arrow, a green arrow, showing the cranial and the caudal. So the cranial is the superior towards the upper end of the body, and then inferior towards the lower end. And then when you're looking at the other arrow that is lying horizontal, you will see that anterior or ventral is towards the front of the body, posterior or dorsal is towards the back of the body. Now let's look at the second picture, which has the anterior view. You can see they have shown you where the right side is, the left side is. There is an imaginary line there, we call it the midline. So that imaginary line, structures that are near that imaginary line are known as what? Medial structures, or towards the midline is medial. Away from the midline is what? Lateral. Good. And I've given you an example of the nose and the ears. You can see the nose is medial to the ears and the ears is lateral to the nose. Then let's have a look at proximal. Let's start, it is in green arrow, so you can see for the upper limb it is showing towards that point of attachment is proximal, away from that point of attachment is distal, same to the lower limb. So keep practicing. There are many other terms related to position and directions that are not here. I've just picked common ones. I'm planning to release a video on MCQs concerning this so that you can practice some common questions that come in your exams. Otherwise, like, share, and subscribe so that you cannot miss any of my videos. Thank you for watching.